Hi, I'm Daniel Strong. I'm a nurse practitioner student at NKU, and I'm doing a health and physical assessment on a patient. Can you tell me your name, please?
Maxwell.
Perfect. I'm going to be asking you some questions as I collect your vitals. Can you tell me what year it is?
2019.
Can you tell me who the president is?
Donald Trump.
And where are you at right now?
The hospital.
Perfect. (122/68). We normally, people average 120/80. I'm going to take your temperature. This does not hurt at all. 98.4. Normally 98.6 is normal, but what's normal? We're going to feel your radial pulse. Your pulse is 80. Now I need you to come over here, and if you can stand up and get on the scale for me. I'm observing his posture and gait as he stands on the scale. Go ahead and stand on it. He is 135 pounds. Go ahead and turn back away so I can put this up. You want to go ahead and stand for me, sir? This says you are 6'2". You want to have a seat back on the bed for me?
Sure.
In counting his respirations as he was moving around, it was 16. So we are going to go ahead and start with their general appearance. He is a thin male. He doesn't appear to have any skin lesions or any sores on his body. He's a little pale today. His affect's a little flat. And we're going to go ahead and look at his hair. We are looking for the scalp. We're going to palpate the scalp for the texture, distribution, lesions, parasites, or any tenderness. Any tenderness, sir?
No.
Okay. No nits or lesions. Next thing we're going to do is we're going to look at the face. We are going to look for symmetry in the eyebrows, in the lips, in the nose, in the face. And then what we're going to do is we're going to ask him to smile. Go ahead and smile. Go ahead and frown for me. Go ahead and puff out your cheeks. Then go ahead and raise your eyebrows. Now close your eyes and try to raise them. So that, then we're going to go ahead and clench your jaws. I think go ahead and open your mouth and close. So there's like a popping sound on both sides for his TMJ. And then we're going to look at his eyes. So we're just going to briefly look at them, see if they're symmetrical. He has a little crust in this eye. So go ahead and look up. We'll look at the conjunctiva and the sclera. And like I said, there's a little crust in this eye. We're going to go ahead and check his vision to make sure. So I need you to go ahead and cover your right eye. And then hold this as far out as you can and read the lowest number you can.
LTFPH.
Okay, that's 20/20. Now cover your left eye and then hold this out with your right eye and go ahead and read it for me, please.
LTFPH.
Okay, and then we're going to test his 6 cardinal fields of gaze. So go ahead and focus on this pen. Do not move your head, but just move your eyes. And this is testing 3, 4, and 6. And then focus on this as it gets closer to you. Go up. You see the pupils consensual. Now we're going to check the light reflexes of his eyes. Just look straight for me. So that one. And normally I would turn the lights out for this, but we're doing this as the practice exam. So we're going to look at his eyes, see if there's any redness or hemorrhaging. And I don't see any. . redness or hemorrhaging in this side. Okay. So we have to look at the eyelashes, and they're long and natural. And since we've looked at the eyes, the next thing we're going to do is we're going to look at the ears. So we look and see if they're symmetrical, if they're in proper placement. We are going to palpate one ear at a time. Is there any tenderness, sir?
No.
We are going to check his hearing by doing first what's called a whisper test. I will say one word and then repeat it.
Baseball.
Perfect.
Soccer.
Perfect. And now we're going to use a tuning fork, and all I need you to do is tell me if it's greater on one side or if it's even.
Okay.
Is it even or great?
I think it's pretty even.
Perfect. Okay. Now I'm going to put this on the mastoid bone behind your ear. Tell me when you no longer hear it, because air conduction should be greater or longer than the bone conduction.
Yeah, I don't hear it. I hear it.
Okay.
It's gone. I don't hear it. Okay, I hear it again. It's gone.
Perfect. So now we're going to visually look at the ears, and we can see that there's no external cerumen or any dirt. And then we're going to look in his ear. So it is clear, gray, and shiny, no impacted cerumen. Okay, we're going to go to the other side, sir. It's clear and gray. Do you use Q-tips?
Mm-hmm.
Yeah, this one has a lot of earwax in it.
Wow.
That's fine. We don't recommend putting anything smaller than your elbow in the ear.
Oh, okay. Yeah, I'm just shoving it all in there.
It's okay. So the tuning fork on top of the head is the Weber test, and the sides is the Rhine test. So now that we've assessed his ears, we're going to assess his nose. And so we're first going to just visualize it, see if how the skin is, if there's any lesions or discolorations. We're going to feel his nose and see if there's any discomfort or pain. Is there?
No.
Okay. Now we're going to palpate his sinuses and see if there's any tenderness or pain. The frontal, the ethmoid, or the maxillary. Any tenderness or pain?
Not at all.
So we're going to have him occlude his right nostril, and then blow out. Okay. Occlude your left nostril and blow out. So there was a greater airflow on the left side. So we're going to have him close his eyes. And I just need you to tell me if you can smell this.
Oh, yeah.
And what is that smell?
Alcohol-y.
Perfect.
Astringent.
You can go ahead and open your eyes for me. We are going to look inside of his nose now. Sorry. So there's no polyps. Mucous membrane's a little bit dry, and it is pink. And turbinates are clear. Sorry. Hold on, keep your head this way. I'm sorry, you're so tall. So it is dry. Mucous membranes are pink. Turbinates are clear. No polyps, but there's a little bit of a deviated septum in his nostril. I'm going to put some gloves on so we can look inside of his mouth. And we're going to be looking to see first if there's any asymmetry in his lips. So we don't see anything abnormal. We're going to be looking for any types of sores or lesions. So I don't see any. We're going to use a tongue blade to look inside of his mouth, and we're going to be checking to see if there's any dental caries, anything wrong with his teeth. So go ahead and stick your tongue out. So he's got a chipped tooth in the front. There's a little blood on the back of this bottom right side. Can you go ahead and open your mouth, stick your tongue out? The tongue texture is rough. I need you to open your mouth and say, ah. Hold on, I gotta get white. I'm sorry. Open your mouth. Like, stick your tongue out. Okay, the tonsils have no exudate. The throat, the throat's a little bit red, and his gag reflex is intact. I need you to stick your tongue out for me. Just stick it out. His tongue is midline, which is cranial nerve number 12. And then what we're going to do is, there was no drainage in the back of his throat or anything. So the next thing we're going to do is we're going to look at the neck. So I'm going to take my gloves off. I'm going to wash my hands. So first, we're going to visually inspect the neck. And if you can see, there's no bulges, no enlargement. We're just going to kind of gently palpate and see if there's any type of goiter or anything. And so then we're going to have him test his face. So turn towards me. Turn away from me. Okay? Now go ahead and put your head on your shoulder. Now put your head other way lateral. Put your head to your chest. And then put your head back. And then is there any pain or discomfort or stiffness?
A little bit when I go back.
Okay.
Minor.
So now we're going to check the lymph nodes. So we have the preauricular, postauricular, submental, submandibular, juxtadiastic, cervical, deep cervical, post-cervical, occipital. None of those had any type of swelling noted to them. Now, I forgot to do one, so I'm going to have him shrug his shoulders and do the supraclavicular, and there's no swelling. And then shrugging your shoulders is a sign of cranial nerve number 11. So we're going to go ahead and check his upper extremities. So I need you to just hold your hands out like this, palms up, and we're just going to count to 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now go ahead and squeeze my hands as hard as you can. There's equal strength bilaterally. And then I am going to have him check range of motion, put his hands up, and then put it behind your back like this. Perfect. And then is there any tenderness in your joint?
No, not particularly.
Okay. Any tenderness in your wrist?
No.
Any tenderness in your joints?
No.
And then I need you to flex and lift your hands. And then I need you to go both sides. Okay? I don't feel any. Then we're going to look at the elbow to see if there's a bursa or any type of swelling in the elbow, and there appears to be not. And then we're looking at here, and there is no bursa or swelling on the elbow or discuss any injury. So we are going to check the radial and brachial pulses while we're doing the upper extremities. We just want to compare them to see if they're equal strength, equal rate, and rhythm. So that is a +2. Now we're going to check the brachial. Okay. Now we're going to check the radial over here. Now we're going to check the brachial right here. And these are all +2. And then we're going to check the color of his arms, which is normal color. There was no warmth or redness that I noticed when I was feeling on the arms. There was no lesions on his arm as well, or no skin conditions like eczema. Since we're doing his upper body, we're going to check the cap refill in every one of his fingers. And then we're going to test on his face and upper arms just to see if he has sensation. If you can close your eyes. Are you feeling this?
Yes.
Okay, perfect. And so we tested range of motion of his arms and wrist, and now we're going to check the lymph nodes in his armpits. These are where the main ones are located. We simply raise the arm, and this is the lateral, this is the pectoral, central, and scaphoid. Little sweaty. This is the lateral, pectoral, central, and scapula. Those lymph nodes are regular.
Sorry.
You're fine. So we are now going to inspect the chest. We're looking for lesions. We're looking for, if you want to turn it back a little to this way, we are looking for any type of lesions on the front and back. We are going to, is this any pain?
No.
So we're percussing over the kidneys, and then we're just going to percuss over the spine. Any pain or tenderness with that, sir?
No.
I am looking for, in his upper back and chest, any use of accessory muscles to breathe, which I do not see any. His respirations are even and regular. Go ahead and turn over this way, sir. We are going to assess the lungs, and how we're going to do that is we're going to go to the different positions. So I just need you to breathe regularly, and turn sideways for me. Can you take a deep breath this time? So the left has 2 lobes and the right has 3. Now we're going to do something called tactile fremitus. So I just need you to say 99.
99.
Okay?
99. 99. 99.
Okay? Now we're going to percuss. Listen for any dullness or any consolidation. Turn more, I'm sorry. It's okay. Okay, go and turn this way. We're going to percuss the upper chest. So now, I didn't hear any crackles, wheezing, bronchi. He has normal chest expansion. He has the 2:1 AP to diameter. And he had bronchial sounds here, bronchial vesicular there, and he had vesicular in the bottom. Now we're going to have him, we're going to recline him like 45 degrees. So you want to lean back a little bit, sir, so that we can, first, we're going to look, just lean back. You're fine. And we're just lean your head back. So we're looking for any jugular vein distension. So you can see it kind of right here. And then we're looking on the other side to see if there's any jugular vein distension. We are going to use the bell of our stethoscope, and we're going to try to listen to see if we have a bruit on the carotid. So first we're going to palpate the carotid. And I'm going to listen and just see if I hear a bruit. Take a deep breath. Hold it, please. Okay, you can breathe out. Take a deep breath. Okay, hold it. There was no bruit heard. So now we are going to visualize the apical pulse. So we go to the mid-clavicular. We can see the sternal notch here. We go down to here. And then we know that's about the second intercostal space. So we go 3, 4, 5, and the mid one's about here. So this should be where the apical of the heart is, or the PMI. This is where it should be the loudest when we are listening in, because this is where the apex of the heart would be. So I'm going to first listen with the diaphragm of my stethoscope. And we're listening to the aortic, the pulmonic, the tricuspid, and the mitral. Now we're going to turn and we're going to use the belt. So aortic, the pulmonic, tricuspid, and the mitral. So I'm going to listen to the apical for a full minute. So I hear S1, S2. I don't hear any bruise or murmurs. So we're getting on time, so we're going to go a little bit quicker. So we are going to do the abdominal assessment. We're going to bring you flat back, sir. I'm going to put your legs up.
Okay.
So we are looking at the abdomen, and we're looking for any distension, any skin discoloration, any lesions. We're going to start by listening, and we're going to go to the right lower quadrant first. Vowel sounds are active in all four quadrants. We're going to listen to the aortic, the renal, iliac. Now we are going to percuss the abdomen. You can hear tympani and dullness over here where the spleen is. Take a deep breath. You can feel it. Now we're going to do, hold on, try it again. Take a deep breath. Okay. No spleen enlargement. Now we're going to do, okay, no liver enlargement. We're going to percuss it. I don't know if you can hear on the video. Get my measuring tape. Five and a half centimeters for the liver. We're going to do light palpation first, and then we're going to do deep palpation. Any pain or tenderness, sir?
No.
So there's no masses in his belly. We can palpate the aortic, no enlargement. We are going to go ahead and see if there's any rebound tenderness. We percussed, we palpate the liver. We're going to have him sit up, and we're going to do lower extremities. So we are looking at the skin, see if there's any discoloration, any lesions, see if there's any things wrong with his toes. We're looking at the bottom of his feet and see if there's a couple cuts or scrapes on the bottom of his feet. His toenails have no signs of clubbing. We're going to check calf refill. Calf refill is brisk. And then we're going to go ahead and feel his dorsalis pulse. If we feel this, all the other pulses should be intact. This is a +2. I'm going to check the strength of his legs. So push up against me, push back. Now we're going to palpate his ankles, see if there's any pain or tenderness. Now push against me. Now push the gas pedal down. Perfect. Any pain or tenderness, sir?
No.
So there's no edema in his legs. We're going to check range of motion. Normally he would have been laying down. Just leg your leg out. Put it up against your chest. Okay, rotate your hip out. Put it down. Just relax. Rotate the hip up. Any pain or discomfort?
No.
I did not observe any palm. Then on the bottom of his feet, we're going to take a tongue blade and see if he has a Babinski reflex where the toes should curl down, and then the toes should fan down, which they did. And so we're going to check the sensation of his legs as we did earlier. Can you feel this, sir?
Yes.
Perfect. And then we're going to go ahead and start doing our our neuro assessment. So I'm going to get my reflex hammer out, and we're going to go ahead and check his bicep. Okay, we're going to check his patella, so I palpate it, feel. Okay, we're going to feel this one.
Oh,
Sorry. And then we're going to have the Achilles. Okay. So now we're going to have the patient take his fingers and see if you can do this for me. Touch your fingers like this, one to each other. Okay. Now take your one hand and touch your nose and touch my finger. Ready? Go as quick as you can. Okay. And then try with this finger hand. Okay. Now I need you to go ahead and close your eyes. Tell me what is in your left hand. Squeeze and tell me what it is.
something metal, like a key.
Okay. Close your right hand. Tell me what it is.
Quarter.
Okay. Close your eyes. What number am I drawing on your hand?
Three.
A number. Two circles. You don't feel that?
I feel it, I just can't figure out what number it
Okay.
is.
What number is this?
1.
Okay. So we're going to have the patient go ahead and stand up. You want to stand up for me? Sure. You're going to walk normal gait towards me. Then you're going to walk heel to toe, heel to toe. Okay. Now you're going to go ahead and stand back. In front of the camera. And you're going to touch your toes so I can check your spine. Spine is normal curvature. Go ahead and lean back up. Now what we're going to do is turn towards me. I'm going to need you to put your leg up on your shin and go down. And then put your leg on your shin and go down. Perfect. And then I need you to close your eyes and put your arms out in front of you and see if there's any waving or balance issues. This is the Romberg test. So the pronator drift test, see if the arms are down. Put it down. And then open your eyes. Now close them. See if you're any. So waving is normal for the test to make sure he doesn't fall for the Romberg's test. I need you to turn this way. Now keep your hips straight and turn towards this way. No. So you're going to turn your body this way and like this, like you're doing the dance to twist. Perfect. So all those were normal. So that concludes our assessment. Thank you.